And welcome to another edition of South Texas Crossfire. This is Attorney Joe Flores reminding you to join us each and every week. As you know, now we're playing in Laredo on KVTV, Channel 13, right after CSI on Thursday nights, and right before Wheel of Fortune on Saturday nights, and in San Antonio, Time Warner, Channel 21. And we're proud, as always, of being here on KTMV, here in Corpus Christi and this market. Bienvenidos a toda la comunidad hispana de Laredo, San Antonio, and Corpus Christi. With that being said, today we're going to be talking about a blockbuster issue, one in which involves healthcare and the amount of healthcare dollars that have been ripped off by consumers. We're going to be talking about that. The first part of the show, I will be doing basic opinion editorial on this issue, and then the next half we're going to be bringing on, as always, our political analyst Juan Reyna and attorney here locally. And we've been getting some very good input from our listeners out there, and we would like to say that if you want to get in contact with us, you can always contact me at theflotuslawfirm.com, and you can go to that website and learn more about us. And also soon to be on the World Wide Web, we're going to have southtexascrossfire.com. That's southtexascrossfire.com, and that will be podcast all our shows, and we're trying to get that message out there to all you viewers of how important it is to know your legal rights. And this is the third part of a four-part series about health care. And recently, as many of you may have heard or soon will hear, Forbes magazine came out with an article which outlined that what is going on, that the system is toxic and there's a lot of money being lost to healthcare fraud. Many of the ideas that the documentary Michael Moore brought out, Sicko, have caused an incendiary among the healthcare profession and the consumers of healthcare. With that being said, it's Forbes magazine's contention that they've got it all wrong. Michael Moore is seeing it upside down. They're not paying too little for healthcare claims. Many of these third-party administrators are paying way too much. And that being said, that they are getting some of the top blue chip corporations. They're hiring these people, such as United, and we're going to be talking about that. Auto Nations versus United is a huge case, and we're going to be talking about that in detail in our second half of the show. But right now, what's going on is that all of these big companies and some moderate-sized companies we're going to be talking about are hiring people such as United and those entities to administer their healthcare plans third party, and what they are contending is that they have overpaid claims, they have pocketed profits, and it has caused severe damages to those companies. And AutoNation did just that. They brought out a lawsuit against United Healthcare last August, and it settled for an undisclosed amount. And we're talking about big dollars. In fact, one of the experts in this field from Accurate there in El Paso, Texas, Mr. Jeff Barber, indicates in our interview here at South Texas Crossfire, when we spoke to him, he indicated that the American consumer is eating up to the tune of $1 billion per year in lost revenue and overpaying. Many of these HMOs and these plans that you're a part of, you pay way too much, and nobody has any oversight. And then the CEOs from these companies or from these groups sign off, and they file these things and say, yes, we took care of our worker, and we said that there was an appropriate amount of money, and that is absolutely wrong. In many of these instances that we're going to be finding out in the next coming couple of months, you'll be hearing more about it, is that people have paid way too much for their health care. In fact, the types of errors and that are occurring are exactly why lawsuits are being filed by the blue chip companies themselves, because this not only affects the consumer, it affects big business, small business, and medium-sized business, and also it also affects the initial public offerings of companies that are going to be bought by foreign companies or investment from foreign companies, because they're seeing this law that we're going to be talking about more in detail in the second half of this show. Sarbanes-Oxley is the law, as you will recall, that was used in WorldCom, that was used in Enron, and they promised the public, and that was the Department of Justice, They promised that nothing like this would ever happen to the worker here in America. And again, and we here at South Texas Crossfire are finding out that there's a different viewpoint out there that's indicating that yes, it is. It's happening once again. And that means that the employer and also the employee may be getting taken advantage of now. The reason we're bringing this up is I think that it's a very important issue, one that needs to be addressed because healthcare affects all of us. In the last couple of segments in our show, we talked about how healthcare is skyrocketing, how we need to stop it, and how the insurance companies and the PPOs and HMOs, the special interest groups and corporations have tried to blame it all on trial lawyers. And that is exactly wrong. The increases in healthcare, as we have been finding out and we're talking about, all come down to the vast majority, 90% or more, because of poorly administered healthcare plans, middlemen who want to line their pockets that we've seen over and over again, and the American public, which is not made aware of this situation. I'm crying out to those healthcare providers to stand up. Not only are we bringing this show to South Texas, but also to the World Wide Web, and we're asking for those doctors, nurses, and other healthcare providers who are on the front lines and see how people are taken advantage of with this pandemic problem throughout the United States, to speak up and let people know that there is false billing going on, that there is mismanagement of healthcare plans. Jeffrey Barber, one of the premier experts at Accurate there in El Paso, Texas, indicates that over 90%, ladies and gentlemen, 90% of hospital bills are inaccurate. And that is proven time and time again. I'm addressing these remarks specifically, not only as an attorney, but also as a nurse practitioner and somebody who's been in the field for over 20 years. I am asking the people out there who've had a loved one who's been discharged from the hospital or who have lost a loved one to look over their hospital bill and question it and ask, were these procedures necessary? Oftentimes, don't just pay a copay blindly. You're the consumer, you're in charge, and many people don't see consumer law applying to getting health care. Well, let me tell you, that is one of the most expensive items next to buying a home that you will ever encounter, and that is having health insurance, if you can afford it. As we've talked about in one of our other shows, up to 25 to 30% of people, including children and the elderly, especially them, go to bed every night without health insurance. And this is a pandemic problem that we're trying to reach out for everyone to have. As me and Mr. Reyna have talked about repeatedly, you need to be aware of your rights. And why should you not hold a healthcare provider or a healthcare entity responsible for their malfeasance, for their bad deeds? And why shouldn't you, as a consumer, say, this is wrong, I'm not going to pay for this? We've talked about in one of the previous segments that there's healthcare fraud all around us that has gone rampant, and it's not getting any better when you privatize much of this insurance and you let these middlemen bill these elderly people for their services. Once again, we've seen that health maintenance organizations and entities like them move in, tell the government, sure, we're going to privatize and we're going to help out and we're going to help these elderly. Many times that is farther than we know from the truth. And I'll tell you why. Because many of these times they automate the system. How many people, and let me educate the people on the World Wide Web that aren't familiar with South Texas, but all of us are here in South Texas.